Hi guys, good morning. So I got this message and I decided to also reply with a video tutorial. Dark under eyes are caused by various reasons. So for you to treat it properly, it's important for you to know the particular what is causing your dark under eye. This would help to know the right product or procedure to use in treating it. So one of the various causes of dark under eyes is aging. As we age, we tend to, so when I talk about dark under eyes, I'm referring to this area. So as we age, our body tends to lose collagen and elastin, and the skin here tends to thin out, which sometimes can give you this impression of your eyes, impression of making you look deep inside. They call it deep set eyes, and your eyes tends to go in and cast a shadow over it. So that is one cause. Another cause could be genetics. Sometimes we find out that it runs in our lineage, and if your problem is genetics, there's little solution to it. Of course, topical products may not work. You might have to go in for some procedures in the hospital, like use laser or derma fillers, which you also have to do continually, or like every 6 months or 1 year, depending on what the doctor says, right? Another reason for dark under eyes could be not getting enough sleep. So when you don't sleep enough, basically sleep deprivation. I'm not saying not sleeping for 2 hours, that's a different thing, but when you don't sleep enough, your blood vessels, like there are blood vessels under the skin here, it tends to be visible, and blood pumps to that area to help you look sharp. You end up resulting in puffy eyes, which would also be dark, right? Some medical conditions could also cause dark under eyes. I know that hypothyroidism is one of the medical conditions that could cause dark under eyes. I also the fact is that it is important to know what is your cause for under eye. If you have deep set eyes, so people have deep set eyes. You can, looking at me now, you can actually see that my hair hold on, let me put on the light. Okay, so the light is also looking at me. You can visibly see that my under eye area is less is deep inside than the other parts of my face. So it's not necessarily deep set, but you can actually see that the skin here is beginning to thin out, which is why when treating dark under eyes, especially if you're aging, especially this is for matured skin and your skin there tends to thin out, it's always recommended to use hyaluronic acid, which helps to pump up your skin and give you that pumped up illusion. So to pump up your skin, and your skin is looking all pumped like this and not thinned out and fresh. Another cause of under eyes could be dehydration. Once you're dehydrated, your skin tends to thin out, which we all know, and which will make the blood vessels under your skin more prominent. So sometimes if you look into people's eyes, especially when they're fair, light skinned, you can actually see the blood vessels and veins here. So it's and some people will say that someone will say that, but they drink enough water. But the truth is that you have to watch out the food you eat. If you consume more alcohol, more caffeine, like I take lots of coffee, I'm a coffee addict, I would regularly the expectation is that I should take more water than the regular person that doesn't take caffeine does, to help flush out all these things and help because these drinks tend to be more drying to the body, right? So it's important to know this. These reasons, you would actually know where you fall into. So if you have eye bags, like when you don't get enough sleep and you just wake up, you have eye bags and they are dark, using product that contains caffeine would help to clear the eye bags. So that being said, so sometimes you can have 2 or more types of under eye. So this will help you to know the kind of treatment to use. If you have veins, if it's just dark and you have veins, you can use retinol for that area. If it's just dark, no veins, just dark, vitamin C overall should do a good job of clearing that place. If you have veins are showing, your eyes are deep set, it's looking inside, hollow inside, you want to incorporate hyaluronic acid and retinol. If it's genetics, if you've done all this and it doesn't clear, when I mean done all this, you have to be consistent with it for 6 months, 3 months. By 3 months, you should see visible results. By 6 months, at least, it should look like mine. Like, done all this consistently, back to back for 6 months, and there's no result, then you may have to go in for a procedure like consider using laser or derma fillers, or even doing chemical peel. A chemical peel could also help.